Again, you and I, we'll notice it real quick with urinary symptoms. We'll get on our Cipro or Macrobid or whatever. We'll take it for a few days. And within probably 2 or 3 days, we'll start feeling better. But it just tends to take, like a lot of things, it just takes longer in the elderly population.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I will be your host for this episode. Today we are talking once again about UTIs, but this time we're talking essentially about the early warning signs and treatment protocols for UTIs. But we're not doing that alone. We have the fantastic Tiffany Puckett with us to walk us through that process. But before we get into that, it is now time for the Nursing Home Regulation Question of the Week. You can win this amazing Nursing Home Abuse Podcast coffee mug. It's perfect for any drink that you love. How do you win this, you might ask? Well, go to our TikTok at Justice for Residents and find this week's Question of the Week video. Look for the picture of Prince in the thumbnail. Prince, music artist Prince. You're going to comment your answer to the question as well as your favorite concert that you ever went to. My favorite concert that I've ever gone to, I'm not bragging, but I've probably been to over 1,000 concerts. But Prince, and I think it was 1996. The ticket said music starts at 8 o'clock, and 8 o'clock on the dot, that little man was out on that stage playing. It's the only concert I've ever been to in my life that started on time. It was an amazing show. Like, that was a great experience. So I'm right here in Atlanta, actually. Drove a few hours to come see him back then. But anyway, comment your answer, comment your favorite concert that you ever been to. We will randomly pick one winner and announce it on Sunday on TikTok and at our website, schenkfirm.com/podcast/giveaway. The coffee mug ships at the end of the month. Good luck to you, everyone. All right. Under 42 CFR 483.60, which of the following best describes a facility's obligation following residents' diets? Is it A, ensure meals are medically appropriate and follow physician-prescribed restrictions even if they conflict with resident preferences? B, provide each resident with a diet that is nourishing, palatable, and balanced while also meeting their daily nutritional and special dietary needs and considering their preferences? Or C, offer a standardized facility menu that meets general dietary guidelines and is reviewed annually by a registered dietitian. And that answer, painfully, was B. It's not just a matter of meeting the nutrition requirements. The diet must also meet the preferences of the resident. All right, now it's time to get into the meat and potatoes of the episode. We are talking about UTIs, early warning signs and treatments, but we're not doing that alone. We have Tiffany Puckett on the program today. Tiffany has been a registered nurse since 1995, almost about the time that I saw that Prince concert, and a legal nurse consultant since 2003. She is currently working full-time as a legal nurse consultant, independent contractor, and has extensive experience with reviewing various types of cases, including auto accidents, medical malpractice, birth injuries, long-term care, nursing homes, slip and fall, and workers' comp. And we are so happy that Tiffany is in the program to talk with us today. Tiffany, welcome to the show.
Thank you for having me.
So we had an episode about kind of like in general UTIs a little while back, and one of the symptoms that the guest talked about was confusion and memory loss. And I wanted to kind of get an understanding as to like when does that kind of come on when there's a UTI, and kind of why is that? Like, why are we talking about confusion when we're dealing with a UTI?
Right. Yeah, it does seem kind of strange, sort of an odd symptom to have. But interestingly, it can be one of the first. And usually, if with the UTI, it's typically going to come on very quickly. You're going to see a pretty big shift in what we call baseline behavior, what their normal functioning is. And when if you see that, and typically this can happen even before the patient even starts complaining of anything that we typically think of as UTI symptoms, that can be the first indicator. So it's one of those things that people really need to pay attention to and be aware of, especially if you know the resident really well, and if you know what their baseline is, and if you see a marked change from that, an alarm bell maybe should go off that there might be something else going on that you might want to text, at least look for the UTI.
If you have a resident that is showing confusion,
Hmm.
okay, like what are typically kind of what is the process by which you get from everything else in the world that can cause confusion to UTI?
Right.
What are the questions that you're asking yourself to get to
Right.
UTI?
Yeah, you probably want to just sort of triage it a little bit in your head, but you look at things like the hydration state of the patient. Elderly population, typically a lot of them are dehydrated. I mean, for that matter, most of us are dehydrated in some form. We don't drink enough, but that's a big one. What type of medications are they on? Are they on diuretics? Are they something that will pull fluid out of them? Um, is it something, that if you're seeing a lack of activity, if you're seeing things that if the patient just becomes really sedentary and lethargic, things like that. Those are things that you would say, this makes me want to delve further into this and see. And you're right. Now, if you have a patient with known issues such as Alzheimer's, Parkinson's, maybe history of a stroke or something of that nature, yes, you need to take that into consideration. But again, even those patients are going to have their own baseline or somewhat norm that they would have. And so with the UTI added on with that, you're still going to see probably a different picture of that resident than you normally see every day.
And I think if I understand you correctly, the confusion, memory loss, these cognitive issues come along typically first before other symptoms.
They can, yes. Oftentimes, that can be one of the first things that tips off either a caregiver or a family member to a potential UTI. Of course, if they have something like an indwelling catheter, or even if they self cath, if they straight cath, that can still happen as well. Hygiene is also an issue. Bathing, all of this kind of stuff. It all kind of plays a part into the potential for the infection of UTI.
You mentioned a minute ago something about hydration, like you want to look at hydration levels. What does hydration have to do
Yes.
with UTIs?
Well, huge. Just because, like I said, the majority of elderly population are going to be to some degree dehydrated. Typically, when you get older, you tend to lose your desire to drink and to eat, quite honestly. We see that in a lot of that population. So it really does play a very big role in that. Um, and trying to get them to drink more can often be a little challenging. They just don't, like I said, they don't have the desire to do it, and it's sort of like anything where you're trying to make yourself do something you don't really want to do. It's hard to do that. um, but again, you combine that dehydration with medications on board that can be dehydrating, such as Lasix or something like that. That's going to make it all the more challenging for sure.
Once we have a resident that's kind of presenting with confusion, maybe they're complaining of pain while they go to the bathroom, or it's more often where we're kind of like, okay, it's likely that it's a UTI.
Right.
What is the next step for that nurse?
I would say the next step would be to get the patient tested for sure. Either whether it's you can do it in the nursing home, or if they have to be transported out to a primary care or a physician of some sort. But I would definitely say to get a urinalysis ASAP to see what you're dealing with. And the majority of the time, once it is determined that there is the UTI, and we start them on the antibiotic, they turn around pretty quickly. Now, little bit different scenario if you're dealing with someone that has maybe chronic UTI. That can, sometimes it can take more than just one round of an antibiotic. It might take multiple, unfortunately. Um, and of course, the potential for longer lasting cognitive effects does play into that issue as well.
What do you mean by that? Like, what are we talking about in terms of long-term cognitive effects?
Well, they can have just the cognitive effects that you do see with the UTI, the memory loss, the confusion, things that just Um, it may be a patient or a resident not recognizing people like they normally had, or not being able to recall certain events that they've always been able to do. If that infection is allowed to hang around for a while, those potential cognitive effects can become a little bit more. No, I'm not going to say permanent, but they do tend to stick around a little bit longer. It might be a little bit harder to get that part out of their system, even with the antibiotic on board. Once the antibiotic starts getting the infection out, I think you're going to start see the diminishing of the cognitive effects.
How long is that typical kind of antibiotic treatment? Like, are we talking a month, weeks?
No, typically, for a just a regular UTI that maybe comes on every now and then, you're going to be looking at a round of about 7 to 10 days of an antibiotic. And of course, there are different ones that they use. It just depends on the physician's preference, and also whatever they typically will also do a culture maybe on the urine to see what bacteria it is, what it's sensitive to. So they'll give the patient that specific antibiotic, but usually you're looking at around 7 to 10 days.
It's interesting to me in the course of doing this podcast, learning that it's the it's the cognitive symptoms that are the best indicators of the UTI versus anything in terms of like frequency of urination, the smell or the color of the urine. It's the
Right.
cognition that's the first warning signs.
Yes.
Is that something as a nurse of 30 plus years, like that's something that you should know, right? As a nurse, like
Correct.
that's what you're looking for.
Correct. And I will say it is, I feel like it's pretty specific to the elderly population. If you or I, happen to come down with a UTI, we're not going to have those symptoms like that, like they do. Research is showing that this is basically it's a reaction to, it's an inflammatory response reaction to the infection itself. And for whatever reason, typically because they are older and more compromised, it's going to affect that population more. Again, you and I, we could probably, we'll notice it real quick with urinary symptoms. We'll get on our Cipro or Macrobid or whatever. We'll take it for a few days, and within probably 2 or 3 days, we'll start feeling better. But it just tends to take, like a lot of things, it just takes longer in the elderly population.
Okay, so we have typical the antibiotics lasting 7 to 10 days or so. And then what happens if the symptoms don't get better? Like what's the next step after that? What are we looking out for? What are we going to do?
Well, where this is, like I said, where typically you would then progress to probably getting a urine culture, which is where you take a sample, goes to the lab, and they actually see what grows out after a period of days, to see what the specific organism is that you're dealing with, and then you know exactly what it's susceptible to and what it's resistant to in terms of being able to treat it. Of course, worst case scenario, you may be looking at IV type antibiotics that you might have to be inpatient for. Um, that doesn't happen too frequently, I don't think, but it's a possibility it can happen. And a lot of this also depends on how compromised the patient is otherwise, with a litany of other things that could be potentially going on as well.
What in general is the difference between the information that you get from a urinalysis versus a culture?
So the urinalysis is basically just going to tell you if there's blood in the urine, if there's any protein, if there's bacteria. They'll tell you the specific gravity of the urine, the just your basic information about it. The culture is, like I said, where they send it to the lab and they actually, I think they put it on a little petri dish. I'm pretty sure we did that in school.
Yeah.
And they actually let it grow out, and then after a certain number of days, they check it and they determine what the actual organism. Because usually what happens is when you get a urinalysis back and you've determined that yes, you do have an infection, we don't know exactly what it is, but we're going to throw a broad spectrum antibiotic at it just to see if we can cover everything and see if we can take care of it with that. If it seems to be resistant and it's not clearing up, then you kind of move forward with the culture, get more in depth with it, and see what are we resistant to, what are we susceptible to.
In your experience, like, has there ever been a time where you've skipped the urinalysis test and went and go to a culture, or is that's just not done?
I have not ever seen that done. I'll be honest with you. It's and mainly because the culture is going to cost more.
Right.
So your analysis is usually a cheaper less invasive way to start things. So
Sure.
one of the things I was going to say too that is really important with with UTIs, and I had touched briefly on, like, if patients or family and friends come to visit them, and a lot of times they are sometimes the first people to notice that something is off with these people. It's, of course, as nurses, we see them every day, but the family and friends that are closest to them a lot of times will be the ones to say something's off with her. She's, and because they know those people better than we do, for sure.
Well, very well said. Well, Tiffany, thank you so much for coming on the show
You're
and sharing
welcome.
your knowledge.
You're
Awesome.
welcome. Thank you for having me. Have a
Sure.
great day.
Folks, I hope that you found this episode educational. If you have an idea for a topic that you would like for me to talk about, please let me know. If you have an idea for somebody you want me to talk to, please let me know that as well. As always, please try to enter the contest to win a Nursing Home Abuse Podcast mug. Make sure that you put your favorite concert. What was your favorite concert? Was it Boys to Men? Was it Creedence Clearwater Revival? John Fogerty? I don't know. Maybe that's how you roll. Whatever it is, input it on the question of the week on TikTok. Win this mug. Get these mugs out of my house for me. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.